Hi, my name is Joan Vassos, and I am a member of the Women's Board of the American Heart Association, as well as reality TV personality.
Hey, my name is Erin Adelakun, and I am a stroke recovery blogger, a stroke survivor, and a mother.
My name is Carrie Petroskis, and I am the mom to a 10-year-old CHD warrior named Brady.
Hi, I'm Ashley. I'm a primary patent examiner, and I'm the mother to Mackenzie, Kennedy, and Zaria.
I'm Dele Somerville. I'm a public health professional, cardiac arrest survivor, and a mother.
My name is Amy Rodriguez Cepeda, and I live with heart disease. I have congestive heart failure, and I'm a mother.
Hi, I'm Donise Tyler, wife, mother of two sons, 22 and 19 years old, senior contracts manager, and a SCAD heart attack survivor.
Hi, my name is Ashley Spees and I am the Chief of Staff at Juno. My daughter Aubrey is a CHD warrior. She was born with severe congenital heart defects, including a coarctation of her aorta, mitral valve stenosis, and an extremely large hole in her heart. And she spent the first 3 months of her life in the cardiac intensive care unit.
Before Mackenzie and Kennedy were born, we knew Kennedy would need to have surgery because she was diagnosed with tetralogy of Fallot. At 2 months old, Kennedy had that surgery to close the hole in her heart and repair the pulmonary valve. Today, Kennedy is a youth heart ambassador and a CHD warrior.
And when Brady was born, we thought that he was perfectly healthy. And what we didn't know was that he was one of 400 babies that day born with a congenital heart defect. 25% of those babies diagnosed with CHDs would not survive.
Over 30 years ago, my daughter was born with a congenital heart defect. Erica is now a thriving adult, actually a third grade teacher, and a mother of a daughter herself. But that was only possible because of the advancements in treatments that grew along with her.
Congenital heart defects are the #1 birth defect that children are born with in the United States.
Congenital heart defects are the most common birth defects in the United States. Black women face serious disparities during pregnancy, including being more likely to have a heart attack or stroke.
Just 9 days after my pregnancy, giving birth to my daughter, I had a massive stroke. I was 38.
Black women have the highest risk of pregnancy-related heart problems in the United States.
Black women suffer serious disparities during pregnancy, including being more likely to have a heart attack or a stroke. Stroke is the #3 cause of death in women alone.
Over 1/3 of Hispanic and Latino women are living with cardiovascular disease. And for far too long, we remain underrepresented in research and science.
For too long, women have been underrepresented in research and science.
Heart disease is the #1 killer of new moms, yet women remain underdiagnosed and undertreated.
May is Maternal Health Month and American Stroke Month.
Brady is now alive and thriving at life. Like I said, he's 10 years old and he aspires to be a heart surgeon, pediatric heart surgeon, when he grows up. He's well on his way. It's one of my biggest, greatest hopes that someday in the future we'll be able to detect Brady's type of heart defect in utero. And just imagine a world where CHDs and heart defects can be fixed before the baby's even born. And I hope that my son, my own heart warrior, is one who will be performing one of those miracles.
This Maternal Health Month, join the American Heart Association in advocating for advancements in treatment.
Learn more about the link between heart disease, stroke, and pregnancy.
This Maternal Health Month, go to goredforwomen.org for resources and support.
This Maternal Health Month, know your risk and take steps to understand the link between cardiovascular disease and pregnancy. Head to goredforwomen.org for resources and support.
Join me in the fight to advocate for better care, more research, and better treatments for children and families fighting congenital heart disease.
Congenital heart defects are still the most common birth defect in the United States, so I'm asking you to join me during Maternal Health Month and join the American Heart Association in advocating for advancements in treatment from pregnancy-related care to prevention and treatment for congenital heart defects. Please join me.